Are you a 45 plus age woman suffering from joint pain? Unfortunately, it's just all too common because it's estimated that 50% of us our age suffer moderate to severe joint pain, and it often worsens over time as we get older. Medically, there is so little that the medical profession can do except yucky medications and surgery. But today, there's new research that helps us know how to relieve that pain holistically and completely. Hi, I'm Dr. Manon Fielding, and through my 30 years of practice as a holistic chiropractor, I've learned how to relieve that pain completely. And we're not just talking about a drink that you can find on TikTok or YouTube. We're talking about eliminating the causes of serious joint pain without the side effects of medications. And yes, it is possible. So watch the whole video and find out how, and please ask any questions because I am happy to answer them for you. All right, let's get started. Why does this seem to happen at menopause? Just another wham, right? Well, there was a study done by Journal of Neuroinflammation, and it talked about how 50% of women that hit menopause have pretty significant joint pain. So they started looking at what were some of the reasons. So let's talk about that. Why does that happen? So often there is some joint problems prior to menopause, and menopause just escalates it. And there are a couple of reasons. Of course, you have the decline in estrogen. All our tissues have estrogen receptors. So when the estrogen declines and those receptors are still on, it causes what they said a low-grade inflammation, really systemically all over the body. And if you already have some joint degradation, some joint problems, playing an instrument, doing sports, having accidents, all of these things that have accumulated problems in the joint, it can inflame those joints even further and start causing pain. So yes, it is related to arthritis, but it's also symptomatic of the estrogen and other hormones. So the other risk factors that they find are obesity and low bone density, which both can also be related to menopause, but also related to lifestyle and other factors. Okay, some of the reasons there. Now, this is the other half of the story. Well, one, we're not 20 anymore. Let me explain what that means. As we start getting older, we have a decline in enzymes in our body. And when we have some irritation in the joint from some of the other things that we talked about in the previous slide, it deposits fibrin. And that fibrin is like scar tissue. You can think of it like scar tissue. It causes us to lose some mobility, and it also increases the inflammation in the joint. So you have that going on at the same time. So the joint is breaking down, adding this fibrin, and it's breaking down faster than we are able to repair it because we don't have the enzymes. So there are lifestyle factors involved with this that I said we're going to discuss. And as we start having problems where most of us will take pain medications, ibuprofen, Tylenol, and other kind of pain, and it covers up the problem, and the problem just continues and gets worse. So that's the other half of the story there. So let's take a look at the medical model. So you go to the doctor with joint problems, and what do? Well, we all know that you're going to get medication. I mean, that's just a given. You go to the doctor, they're going to find some kind of medication that fits what your problem is. And I don't know if you remember, Vioxx was one of the wonderful drugs of the year. And unfortunately, about 140,000 people, mostly Americans, died from heart attacks because of Vioxx. And others suffered other problems as well. So what about ibuprofen? That's like over the counter. It's safe, right? Well, most of us think of it that way. And what I found when you read the labels, that you're only supposed to take it for a few days, 7 to 10 days at the most. And most people take it not only days, but months to years. And it can burn a hole in your stomach, and it can cause kidney disease. There are many things that it can do, but those are two of the biggest ones. So what about diclofenac? That is another one that is commonly prescribed for all kinds of arthritis. And I just wrote down here some of the common side effects, and I'm just going to read a couple of them, and you'll get the point. But all of these are common side effects, not infrequent ones. Acid and sour stomach, belching, bleeding gums, blood in the urine or stool, bloody or black tarry stools, chest pains, chills, cough, cloudy urine, constipation, dark urine, decrease in urine output. And you see a lot of these cause these side effects, and you go to the doctor for these side effects, they probably put you on another medication for the side effects. Then it gets worse and worse and worse. You go to steroids. So there are systemic steroids that have many, many horrible side effects, including losing joint bone density and being able to cause bone fractures. And then, of course, you have the opioids, which we all know the major problems with that. And they keep coming up with these like wonder drugs, and really all of them have serious side effects. So this holistic 3-step model that works for almost everyone for many kinds of problems. Today we're just talking about the joint issues, and it's 3+ steps. I'll explain what the plus is in a minute. So the 3 steps are: 1, testing and working with someone who can understand the testing and be able to prescribe and make sure that you're following a program. 2, supplementation, some kind of nutritional support. It may be foundational support or targeted support specifically for the joint problems. Today we're only going to talk about the targeted supplementation. And lifestyle factors. And today we're going to talk about the 5 major lifestyle factors that affect joint problems specifically. And I'm going to recommend for you to take the Menopause Anti-Aging Quiz if you haven't done so already, which is going to go through many different lifestyle factors, allow you to score yourself and see where you fall on the aging parameters. If you're aging faster than your years or slower than your years, then you'll know how you're doing in terms of your own lifestyle. Okay, let's take a look. So step 1, I said, was a hormonal testing and balancing. And the hormonal testing and balancing, how does that really help? So we use a test called the Dutch Complete, and it's a 24-hour urine collection. And the reason that I like that one so much is that it shows balance of different hormones over a whole day. And it also looks at a variety of different hormones, not just estrogen and progesterone. So it looks at cortisol, estrogen, thyroid hormone, I forgot what the other one is, other adrenal hormones. And it shows you where you fall on the range for your age group and where you are in your menopausal, are you perimenopause, menopause, reproductive time, because a lot of women will use it prior to menopause, and postmenopause. And it also shows your cortisol levels on a 24-hour scale. It looks at some of the vitamins that are important for for your hormone balance. And it just has like a lot of different health parameters beyond just the estrogen and progesterone that really help to target the issues that you're having. So cortisol and estrogen are the main ones specifically for joint problems. And if you have high cortisol, it can increase joint pain and inflammation, and low estrogen increases joint pain and inflammation. So those are the 2 we're going to be looking at on that test if your problems is joint pain. So you can positively influence hormonal issues with supplements. And I'm not going to go into a lot of detail of this because a lot of it does depend on the person. This is customized to our clients. But for an example, flaxseed helps increase your estrogen. Isoflavones increase estrogen. Black cohosh increases estrogen. Ashwagandha helps to reduce the cortisol levels. And like I said, there are many others. Adaptogenic herbs is specifically the kind that I really like because they really balance the cortisol and the other hormonal organs naturally. And there are, like I said, numerous ones that do that. There are also many lifestyle factors, and working with us as your health and life coach, we're going to help you key in on the ones that are going to be most important for you, for the conditions that you suffer with, and using a mind-body connection to help reduce the stress also tremendously reduces cortisol. So let's take a look. Okay, so we work on getting your hormones balanced, and then we need to decide on some supplements for your joints. So based on multiple clinical studies, they have found that the importance of proteolytic enzymes. You know how I talked about the fibrin that builds up in the joint over years usually? There are enzymes that you can take because we don't have enough in our body, we can take enzymes to help remove some of that gunk from the joints. So if you have a lack of mobility, that's probably one of the reasons that you have that. And I just gave you an example here of Zymex, which has some of these proteolytic enzymes. And I really like the standard process formulas because standard process, if you're not familiar with them, they have their own organic farm. They produce all their own vitamins and minerals and nutritional formulas on their organic land. And you know that you're not going to get heavy metals or other things that are tainting them, and that you're getting what you buy. And those are two very important things with supplements these days. There are so many that promote having certain ingredients and they don't actually contain that. And two, it's becoming more of an issue in supplements that heavy metals are getting into our supplements, and that really is more prominent on supplements that are coming out of China and Taiwan, but also other areas as well, only because they're more in the soils and they're being produced in those areas. So that's a very important consideration when you're buying supplements and knowing who you're getting them from. All right, so let's take a look at the next one. All right, and there are other studies that were done that looked at the potential of natural extracts, and there are many studies on the ones that I'm going over now, but I just wanted to give you some basis for that. These are ingredients that are known to benefit not just inflammation, but also the pain of joints. And I actually think that this with the enzymes work best together, especially if you have a pretty significant problem. So turmeric is one of them, and turmeric, the extract from turmeric is curcumin. So this is just one of the Life Extension is a very good brand. I do recommend them as one of the ones that we use. But turmeric, Boswellia, I don't know if a lot of people aren't familiar with that, but it's an Ayurvedic herb, and it really helps with pain. It goes to the nociceptors, which are your pain receptors in the joint, and helps to calm them down. So the turmeric reduces the inflammation, the Boswellia affects the pain. The ginger does a little bit of both, and the galactomannins, I believe that also comes from turmeric, if I'm not mistaken, but these are also very helpful for joint problems. So this curcumin elite is one of them that has that. We use a few other different ones from other makers, but like I said, be careful that you're buying from somewhere that has tested on the outside and tested to have the ingredients they say is in there, and also not to be tainted with heavy metals or anything else. So those are some very important herbs for joint problems. All right, so now we get to step 3. And remember, I told you it was going to be lifestyle is the third one. And this is the least favorite one that everyone wants to just take a supplement because it's like medication and forget about lifestyle factors. But these are some of the most important ones. And we're just going to go over the 5 that I think are the most critical specifically for joint issues. But I would love for you to take the menopause anti-aging quiz, and I'm going to put that in the description so that you can take that quiz, because there are many, many more that affect all kinds of our menopause and aging symptoms that you can start working on, and it will really show you some major improvement in all areas of your life. So if you were to guess, what would you say was the number one factor that causes joint issues? It really is a factor that causes multiple issues, but joint is definitely one of them. What would you say? Think about it for a second. Well, maybe you guessed it. It is sugar, which is our number one love in our food and drink, but it is also the number one ingredient that causes damage to the body, unfortunately, especially in higher dosages, and some people worse than others. This group called Intermap looked at 4,680 men and women from all over the world. They were looking at fibrin levels and relating it to dietary factors in different areas of the world. Well, fibrin, I did tell you that affects our joints and it causes problems with mobility. So that if your joint is not moving properly, it's probably because you have increased fibrin tissue in there. It's kind of like scar tissue. It doesn't only affect joints, though, it also affects our arteries. So it's very critical for our well-being, because when fibrin builds up in our arteries, it causes atherosclerosis and can cause heart attacks, heart disease, and those kind of things. So a lot of issues. Well, what they found, I'm going to actually read this to you. High sugar intake from sweets and drinks in the United States has been repeatedly designated a remedial behavior adverse to health. Importance of reducing this excess sugar intake may be a valuable public health implication of our study. So they thought it was important enough to put it in this study and point out that us Americans don't do so well with sugar. And it is a major contributor to arthritis, and it is also highly addicting. And I didn't realize this until I looked at the study. It talked about how rats that were given sugar or cocaine actually preferred the sugar. That sugar is that addicting that they preferred that to cocaine, which is, I think about it, pretty amazing. And so how much can we eat without causing major problems? And some of the information research that I've seen is 30 to 90 grams, 90 max. And if you look at the carbs that are on the packages, that's really very easy to go over. And most of us go way more than 90 grams. And that's part of the issue. Our pancreas cannot process that many simple carbs, and all simple carbs break down to sugar. So it's not okay to think that you can eat crackers instead of cookies, in other words. So that includes sugary drinks, white bread, pasta, French fries, potato chips, cookies, cakes, pastries, candy, chocolate, ice cream. You can add donuts to there. There are a lot of things you can add. Anyway, I'm very sorry to give you this diagnosis here, but sugar was the number one. And if you're having trouble breaking away from sugar, there are things that you can do to help that. I'm not going into that today, but we can definitely talk more about that. I will be doing a video on that. All right, let's go to the next one. Factor number 2 is trans fats. And trans fats includes hydrogenated and partially hydrogenated oils. Now, it did become illegal within the last few years to add partially hydrogenated oils to our products. But that doesn't mean that they're not there. And I didn't realize this until I started studying the subject. I'm going to explain that in just a second. But hydrogenated oils are in meat and dairy products, so those are where we get some of that. Coconut oil, which a lot of people think is healthy, is very high in hydrogenated oil, and so that does increase some of those problems with joints. French fries. Now, French fries, especially when you get them in a restaurant, they can be cooked in, they may have partially hydrogenated oil in their fryer because it's easier for them, and they often use that. So you got to be aware of that. And these are the other ones: canned frostings, baked goods, margarine sticks, coffee creamers, crackers, and a lot of processed foods have, as they process them, the oil becomes partially hydrogenated, and it's part of the processing. So they're not actually adding it, but it is in there. Very tricky. All right, all of those contribute to joint pain and inflammation. All right, factor number three, barbecued and fried foods. So these are any foods that are cooked at high temperature. And the reason that is because it destroys the enzymes in the food. Remember, I told you we already had a decrease in enzymes in our body, and decreasing the enzymes in the food, then we don't digest them as well. The increase causes increased inflammation and pain because of structure changes also in the food, which causes these TFAs and AGEs, which are biochemicals that are very toxic for our body, and especially for our joints. So any foods that are cooked at high temperatures. So even if you're grilling vegetables at a high temperature, that can be an issue. Yeah, and fried foods definitely are a problem. So what I have done myself is started cooking more in my air fryer, and that has been wonderful. And I cook it around 375, and I get that nice crusty outside and tender inside, and it is so much like my barbecue without causing that kind of problem. I just love it. And factor number four, alcohol. Now, alcohol may have some beneficial effect when it's at a very low level that many people don't stick to. So that means 1 drink per day for women and 2 for men is basically the guideline. And the reason is that alcohol increases CRP levels. CRP levels is a measure of the inflammation in our body. So when inflammation is higher, it's going to be more detrimental to our joints. And that is especially important, as I mentioned, menopause and beyond, because of all the other reasons. All right, so avoid excess alcohol intake. And the last one is gluten. Now, gluten can cause leaky gut. It's a large molecule. It's not very well digested. And not everyone is going to have a problem with gluten. It does seem to be worse with women who have rheumatoid arthritis and psoriatic types of arthritis. That gluten really causes a lot more damage and problems. And our inability to digest gluten does decrease as we age. So if you're not familiar with what is gluten, it's in wheat, oats, barley, and rye, which if you read labels is pretty much in everything. But you can definitely get things that don't include gluten. So if you have joint problems, you might try to eliminate that for a little while. At least the wheat is the one that's the highest, and see if your joint problems improve. Then you know that you're sensitive to gluten. Even if you don't have what they call celiac disease, a specific biomarker saying that you're allergic to gluten or something, it still may be affecting your joints. That's factor 5. And as I mentioned, we have the plus factors. So that's why I said 3 plus. And I include this in any type of holistic healing for any condition is spiritual development. And what I mean by that is the mind-body-spirit connection. Because what they found in numerous studies, which I have put down here, there's really actually been a growing body of research on this, is that women who have a spiritual practice have less severe and fewer menopause symptoms overall. They have an overall more satisfaction and better quality of life. They have less psychological menopause symptoms like depression. And they have a more complete healing from any condition when their mind and body are connected. And I can attest to this, that in the last few years that I've been meditating daily, it's literally changed my entire outlook on life. and it has allowed me to be more loving, to be happier and have more joy, better relationships. It's just enhanced my entire life. And physically, I feel fantastic. I'm almost 70 now, and I think I have more energy. I have far less pain than I did when I was in my 50s or 40s, even, or even younger. So I strongly encourage you to add this piece to your practice. So I just want you to know, no matter how much pain or suffering you're going through, you can do it. You can always change. As long as you're alive, we can change, right? So if you are interested in learning more about our program, you can find it at askmeanythingaging.com, menopause.askmeanythingaging.com. And if you like this video, please subscribe to our channel. We're going to be doing a whole holistic series of a lot of different conditions that I think you'll benefit from. And I also just remind you to take the Menopause Anti-Aging quiz that I'm going to put in the description so you can get started. All right. Have a fantastic day. Namaste.